Secretary Doug Collins is a year into his tenure at the VA. He joins me now for a look back at what he learned over the past year and how those lessons informed his plan to reorganize the Veterans Health Administration. We'll also examine how VA is making progress in benefits eligibility decisions and payments. He'll lay out what's changing and why, and what he hopes to accomplish in the year ahead. Secretary Collins, thank you so much for joining me on the show today.
Okay, thank you for having me.
You are just wrapping up your first year. You are not new to government. You're not new to Veterans Affairs, but you were new to the VA. What most surprised you as you look back on the last 12 months?
Well, as I think the associated gray hair in my head will tell you, it was all of a sudden seeing an agency that has such potential, great potential, that really had allowed itself to become inwardly focused instead of outwardly focused. I think that's the biggest thing that surprised me once I got here. I was used to dealing with it from the outside, but when we're actually inside, it began to over years of being badmouthed, put down, always complained about, there began to be what I would consider a cocoon effect or a shell effect where VA was only doing what they felt risk enough to do. And from day one, we said, no, we're going to put the veteran first in anything that we do, so that now anything we do is not filtered through, is this good for the department? It's going to be, is it filtered? Is it good for the veteran? And I think that's made the biggest difference. And that was one of the first things I said. Everything else we talk about today has to come off of that one premise.
Well, as we move from what you've noticed to what you're trying to fix, in December, you announced a sweeping reorganization of VA healthcare. Everything from centralizing your visits to standing up new health service areas. How are you ensuring that structural change actually improves care rather than disrupts it?
Because we know right now it's not the care is suffering. We know that under the current system, and look, anybody, and I don't mean this to be critical of others. There's always a room for questions, and that's why we rolled this out in December. By the way, Terry, we started this early. We got with VSOs, we got with Congress. We've been doing one-on-ones with different members. I mean, we've been laying this out, and also tell them this is our general format. This is how we're looking to do this, and we've already had some great input that's actually changed a little bit of our direction, as you always have with a big plan. We, as of course, statutorily, if we begin to move people and we move that, then we'll have to notify Congress with a more detailed plan. Right now, we're in that early phases of making sure we have it right before this is put out and continuity of care is taken care of. But I'll also say anybody that comes out now and says, ooh, this is not something we should be doing, VA's not doing this right, I just have to remind them of 30 years of both bipartisan griping on the Hill is about the VA. And it has been from both Republicans and Democrats, chairmen and ranking members, that the governance structure has to change. All this has to change. VSOs have said it. GAO said it. OIG said it. We've just determined that we're going to be the administration that actually does it. And so we're taking in all that input. We're excited about it. Contrary to the people who don't want to see it change, if you're invested in a bad system, then you don't want to see it change because it changes what you do. Everybody that's looked at this from the VSO side and actually looked at it, our leadership in our hospitals are really excited about this. And I asked one of our career employees, I said, what do you think about this? Because I was actually really interested. And they said, sir, I don't know why we haven't done this before.
How will veterans experience a measurable change in care as you roll this out?
I think the biggest way is it's going to be transparent for the most part to the veteran itself. This is a reorganization that was really not touching the hospitals and the clinics per se, except that they're probably going to see more clinicians in there that have been in the VISN level doing administrative work. We're going to be reorganizing to put more clinicians and nurses and doctors, those kind of things, back into the hospital with more time in our clinics. So they may see newer faces. They may see, definitely we're going to look at how that would affect wait times as we go forward. But this one was one that we were not allowing our VAMC directors, the ones who run our hospitals and in turn run our clinics, make decisions. They were basically being handcuffed for years. They would ask to, do a program or to start something, and they would send it up to what became this plethora of committees up here that none talked to each other. And a year or so later, it just sort of died because nothing was happening. So we're streamlining that. So the VAMC directors and the chiefs of staff will actually be able to do their job on the front line, their tip of spear. Everybody else is just going to be support for them.
This reorganization coincides with a new community care contract structure that could possibly be $1 trillion over the next decade. How will you ensure the correct balance between veterans who get care in VA facilities and those who get care in the community?
Well, part of that is actually is the law. I mean, that's following Mission Act. And I think what we have to do is unfortunately in the previous administration, which caused some chaos here, especially with community care, they had sort of done away with it to keep everything internally for various reasons. And what we're doing is a balance. If the veteran wants to get part of their care at the VA, they get direct care from us. If they want to go into the community through best medical interest or their wait times and others are outside the parameters, then they can go to the community. What this new contract is going to do, though, Terry, and I think this is really important for anybody listening, VA has been treated as a different entity. And what I mean by that for a long time is we're the largest healthcare organization in the country, but we don't act like it. And so what we have is we're measured by wait times. No other hospital or public or private, is measured on wait times. This new community care contract and our new system of scheduling is going to allow the veteran to see in real time what the potential wait time in the VA is versus a potential wait time at 3 or 4 places in the community. I think the biggest assessment is going to be the community having to explain why they're so long in many of these because they don't actually measure it. I have private health care still. I'm not in the VA system, and I don't know about you as well. But the idea of waiting, 2 weeks or even 2 or 3 months for a checkup or a physical is common practice. We do a lot of those a lot quicker in the VA. So it's going to be a lot more transparent. It's going to get people into the community where they need to and also enforce our direct care.
Your own IG and the GAO have documented quality problems with community care. Will this new contract have different kinds of metrics to ensure that the quality care provided in communities matches the VA?
Oh, very much so. In fact, that's why we're doing it. And as I shared recently with the House Veterans Affairs Committee and the Senate Veterans Affairs Committee, this is a 10-year, it's still under RFP right now, so there's limited stuff I can talk about internally about this process. But when we first did this, I was on the Hill when we passed Mission Act, and I was there when we passed Choice Act, which was a complete disaster. Mission Act, though, brought it in, and we didn't have that many people wanting to help us in the third-party administrator side. We do appreciate United and Tri-West for being the partners that they've been. But we had controls built in, but VA chose not to exercise those controls many times. So if we were seeing a community care provider not providing their billing on time or they were doing something, we were not seeing the third-party administrator actually hold them accountable. We've taken basically almost 10 years of work and put that into the RFP so that they know coming into it, we're going to hold them accountable for handling community care, them accountable for billing, them accounting for fraud, waste, and abuse, just like we do with our own self. And we're also going to have monitoring in there that we can actually, hold them accountable, the third-party administrator, if they're not doing what they're supposed to be doing. So we're really excited. If you look at it from a healthcare perspective, this new contract in the RFP that was led on this is putting VA at the very cutting edge of this technology.
Well, certainly healthcare is the predominance of what VA offers, but it's not the only thing. And I want to shift over to the other side of VA for a minute. Affordability is top of mind for a lot of veterans, and many of VBA's programs help address affordability on the programs that veterans rely on every day: home loans, GI Bill, other sorts of disability claims. How are you coming on the backlog and timeliness?
VBA is some of our best stories imaginable. When I got in here a year ago, we had a 260,000 plus backlog of over 125-day claims. As of yesterday, we were just under 100,000 in less than a year of actually putting that. That's taking wait times that were taking 135 days average to complete. We're down in the low 80s for average days to complete. And frankly, if I can work with our friends and our colleagues at the Department of War, we get the records and stuff transferred in a more timely fashion. We're getting down to 30 to 40 days on which we could actually have disability claims processed. That is a huge win that is helping veterans get their determinations early. The quality is excellent. And if they still want to, if they didn't think they got what they wanted, there's still the appeal process as well. So that has been great. Home loans, GI Bill, GI Bill stuff's being processed same day. V8 home loans, all are still going well. The Congress passed the partial claims bill. We're working on that implementation now for those who are in trouble, maybe with their mortgage. So we're doing everything in our side for educational benefits. VR&E, we just announced recently we're getting ready to hire over 300 people for our vocational rehab and education branch, which is going to cut our counselor to veteran disparity down. which means that we're, again, moving those claims quicker, getting them the vocational rehabilitation counseling in a better, more timely way. I'm very proud of our VBA folks.
You've just rattled off a number of statistics and metrics there, all of which are trending in the right direction. But there's new bipartisan legislation in the Senate that would require a national veteran strategy every 4 years that would be different from VA's strategic plan. And it has language in there that says veteran success is a national interest that goes beyond the VA. If that language were to pass, what are the key metrics that you'd want to see in that to share broadly that VA is making progress on veteran issues?
Well, I appreciate anything our congressional colleagues do to, in their role is from oversight and help going forward. If it passes in its current form or also is amended, we'll definitely do everything we possibly can to make sure that that's carried out. I think the biggest thing, though, Terry, I can tell you is this: I really want to get to the VA to where we act and are judged by our quality of care and how well we actually access patients, instead of the arbitrary numbers of wait times and other stuff that have sort of taken us off the mark of being a truly 21st century healthcare system. I think also in disability claims, the other stuff we just talked about, aligning those with making sure we're available to every veteran. We still have probably 6 to 7 million veterans in this country who access zero of their VA eligibility. And so we're reaching out. We just started a process, and I think this will be a metric that we could have, is how are we reaching out to those who are unaffected by VA right now? And I can tell you, we've been sending out literally millions of emails and text messages, and we've also already enrolled almost 30,000 new veterans into the system in just the last 60 days. That's a pretty big claim. So I think aligning again, let me go back to our very first statement I told you in this interview. It's veteran first. That should be any report or any standard should be, is it veteran first? And then how does the VA carry that out?
Well, sir, we'll look forward to checking back in with you a year from now and seeing how you're doing.
Can't wait.
Thank you so much for joining me.
Take care.
That was Doug Collins, Secretary of the Department of Veterans Affairs. We'll post this interview at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts.